Every year, millions of North Americans go abroad for surgery. But how is that choice really made? Most people assume it comes down to comparing prices. It doesn't. The decision is already taking shape long before that. Before patients compare surgeons, certain names already feel familiar. That familiarity shapes who gets attention first, and who feels easier to trust. Patients don't start from zero. They start with names that already feel known. Names they have seen before tend to stand out immediately, like an old family friend, even if they cannot remember exactly where they saw them. That's recognition. It builds quietly through repeated exposure. In places patients see every day. Across places patients already trust, long before they actively search for surgeons. Before they compare options, or before they reach out to any clinic. Some international surgeons understand this shift. They don't wait for patients to enter comparison mode. They show up earlier, before patients even realize they may consider going abroad. Before medical tourism is part of the conversation. At that stage, no one is choosing, but familiarity is forming. And that changes everything later. Because when those surgeons appear again, when patients are actively researching medical tourism, they don't feel new, they feel known. Trust builds faster. Consideration happens quicker. Hesitation drops. It shortens the distance between discovery and decision. So when comparison finally begins, some names already stand apart. Not because they are louder, but because they showed up earlier. They become the obvious choice before comparison even begins. The real question is whether your name is one of them.